Welcome, everyone. I am Laura from Transition Town, Jericho. Great to see folks here tonight. This is part of our resiliency-themed series. Try to keep them going at most months on Mondays. And tonight, we're very proud to have Rose Rochford here. Rose is new to Jericho, and as a member of the Food Hub, I would say we're very happy to have Rose and Tom as newcomers and new town organizers. Very exciting. So Rose, do you hail from Colorado?
Yep.
Yeah, from Colorado, and she is Professor Emerita, did I say that right? At the University of Colorado, co-director of the Colorado Consortium on Climate Change and Health, and the founding director of the University of Colorado's Climate and Health Program. I think she'll let you in on all that a little bit more. And I will, without slides, without chalk.
We'll make it go.
Thank you, Rose.
All right. Well, it's a pleasure to be here, and thank you all for coming. We're just going to make do. Like I say, you haven't been a professor for all these years without being able to get up and profess. So that's what I'm going to do today. And we're going to talk about why climate matters to health, but I wanted to give you a little background of why it matters to me and why I have this piece here. So I'm just going to have these slides up here. And if after the talk I have a little sign-up sheet in the back, and if you want to, I can send you the slides so you can have the details. And I also have a list of all the resources that I used for the information, so you can take a picture of that, so you can do that afterwards. So, but I started back in the early 2000s. I actually went to Kenya 2001 for the first time to work on malaria, and that's been my major focus of my research project, looking at how our body fights off malaria, what happens to our immune system, and what goes on with that. So you'd say, well, what does that have to do with climate change? But the mosquito that transmits malaria is a climate-sensitive mosquito, Anopheles, and that is important in thinking about climate change. And in Kenya, people started talking about, well, if it gets warmer, what will happen? Will the mosquitoes start transmitting malaria up in the highlands of Kenya? How will it change? I had other friends who also worked on dengue, a bunch of infectious disease people. We like to talk about our pathogens of interest. And so they were talking about that's transmitted by the Aedes mosquito, and really seriously looking down in Ecuador on climate change and its impact on these mosquitoes. So really trying to understand resilience in that context. So I started thinking a lot about climate. And we got to Colorado and we were there, and a whole group of us came together in 2015. And what we were interested in is there were climate scientists, epidemiologists, global health people, social scientists, and we were all coming together to try to think about, well, we're interested in how climate's impacting health, what can we do? And that's when we founded this consortium, a bunch of scientists on the Front Range of Colorado, and came together in 2015, and unfortunately, if you can think about the timing about trying to get research dollars for climate in 2016 wasn't so good, not good timing. But what we did was we learned a lot from each other. I didn't know much about climate science at the time. There's a lot of things I didn't know. But over the years, we've shared knowledge with each other. We've taught in each other's courses. We've gone to conferences together, and really trying to think about that health impact of climate on us. So that is how I came to this. And this picture down here, we started at the School of Medicine, the first climate and health program that educates physicians on impact of climate on health. And we now have a diplomat program for anybody who's a health professional that can get a diploma in climate and health, and we work with physicians as well in training. So, and if you live in Colorado, it's hard not to think about the forest fires and beetle kill. So today what I wanted to talk about is a little bit about climate science, how we know that the climate is warming, what's driving it with the CO2. I want to talk a little bit about impacts of climate on health, and then thinking about Vermont specifically, what's changing here, because Stephen Colbert said it's not climate change, it's climate changed. So it's already changing. And then talk about food, because being part of the Food Hub and thinking about how food is impacted by both climate and how it is impacting climate, I think is something that we can all try to tackle. In the back I have 2 books there that if you want to borrow them, you're welcome to borrow them, but they're one by Catherine Hayhoe and one by Christiana Figueres, thinking about much more hopeful, how do we think about climate change in an optimistic and hopeful mindset. And I think it's really important as we sort of hear these values and ideas and things that are wrong to think about how we can make things better, because we want to kind of get our head around that. Also, please stop me if you have any questions. I'm happy to answer them and go from there. So the first thing is this climate. How do we know what's going on? In August, I got a chance, I don't know if you've ever heard of the Ice Core Lab, National Science Foundation Ice Core Lab. It is the coolest place in the world, and it really is one of the coolest laboratories I've ever been in, because it's at minus 40 degrees Celsius. And the Ice Core Lab is funded by the National Science Foundation. They drill down in the Antarctic, the Arctic, some glaciers. They go down almost 2 miles and pull out ice cores. And we got to see a video of how they do that. And if you ever have a chance, you can go on their website and learn more about it. But they store all the ice cores in these tubes at minus 40 degrees. They ship them to this laboratory. And the thing is, in those ice cores, you can date them because you can see sediment in them. And they go back, I think they've just got, the data I have is from 800,000 years ago, but they go even further back. So 800,000 years of gases trapped in the ice from the Antarctic. And if you can pull out that gas, very carefully mind you, and measure it, they can measure the levels of CO2 over 800,000 years. And the levels go very normally cycling up and down and up and down and up and down. However, right about the industrial age, somewhere in the 1860s, the levels go up, 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 up. And now they're far outside the normal range over 800,000 years, whereas the top before was about, I think it's 360 parts per million of CO2 in the atmosphere. Right now we're at 417 as of 2022. So CO2 is definitely increasing in the atmosphere. But you might also argue, well, how do you know that's actually due to burning of fossil fuels? That could just be a coincidence. However, our clever scientists also are able to measure carbon dioxide, CO2 in the atmosphere, C, 1 carbon, 2 oxygens. The carbon, you have carbon with an isotope of 12, 13, or 14. Different isotopes, and you can actually measure that. The normal CO2 that's in the atmosphere has a carbon of C13, the molecular weight of it, the physical weight of it, the isotope weight. If it's a C12, if it's burnt from fossil fuels, from plants, it's a carbon 12. Fossil fuels are organic matter that have been decayed, and when you burn that, it releases the carbon 12 into the atmosphere, and you can actually measure that level in the ratio of C13 to C12. And just the same time as CO2 is going up, the ratio of C13, the normal level in the atmosphere, to C12 starts declining, which means there's way more C12 coming from that burning of fossil fuel. So we know it is burning of fossil fuel, CO2 is increasing. Now the downside is, of course, Catherine Hayhoe talks about climate weirding, which I really like that phrase. The climate's gotten weird. But we know 2024 was the hottest year on record since we started keeping records. So it is not good, right? We're at the Paris Climate Accord in 2015 wanted to keep temperatures down to the temperatures below 1.5, but we just surpassed that. So, and we thought we had till 2030. Ooh, coming in the wrong door. So, warmest year on record. The last 10 years have been the last 10 warmest years on record, so things are definitely heating up. So temperatures are rising, but that's the mean temperature around the entire planet. But when we think about going back to our math and we think about that graph and the curve, a mean shift like this means that the mean find out. So anyhow, so the mean is shifted, right? And when the mean shifts, you can't really see this, but if I had a chalkboard, I'd draw it like that. And over here on this side, you're going to see more warmer temperatures and less cooler temperatures, right? So it's going to shift that. So now we're getting actually, in fact, a lot harder temperatures. And in Vermont, we're both wetter and hotter. And in Vermont, we have 6 inches more precipitation per year than we did back in 1960s. So there's more rain. Our length of the last frost-free date, that's increased by 3 weeks. Our temperatures are increasing here as well. So we've got more moisture, which is a problem. We know that from 2024 and 2023. When the moisture comes, it comes harder and faster. That causes a problem also for problems with runoff into the rivers and to the lakes and having what's called eutrophication, which is the increase in nutrients into the water so that cyanobacter or algae can have the algae blooms and loss of oxygen in there. So there's not good here. So we've heard a lot about climate-related hazards, Colorado, but California, just this last horrible fires there. So we think about wildfires, we think about hurricanes, drought, extreme heat, extreme weather, and infectious disease, my favorite subject, sadly, for some people. But if we think about them, they all can impact our health, right? So all of these different things are impacting us and how our health works. And what I wanted to do was just talk about three areas. Can't forget the infectious disease, that's just me. I want to talk about heat, and I want to talk about air quality, and I want to talk about some infectious disease. What I'm talking about is thinking more broadly about climate change on health and how it can affect us. I'm going to focus on the effects of heat on us, on a health perspective. I don't know, how many of you have thought about how heat affects our health? Are we our health experts? Okay.
And the quality of the air, too.
And the air quality, yeah. Well, both of them are really important. But one of the things that we want to talk about is not just the heat, but the heat index, right? So on your phones now, almost all smartphones that have the weather app on them can tell you the heat index. It feels like, so it has the temperature, and then it feels like right now, today, it felt like 16 degrees when it was 28 because of the wind chill. You can go the other way, and the heat index is the temperature of heat and humidity in the shade, right? So in the shade. And what you can see, this is a graph from EPA. As humidity goes up, it doesn't take that much rise in the temperature for you to feel really uncomfortable and start moving to more dangerous heat levels for the body. And Vermont, this is from the summer in June, we had a heat wave here. And our heat index not only went up, you can see in the red areas over here, a lot of cities and within Vermont were way above the healthy heat index for people in Vermont. So even though it's generally cooler here in Colorado where we just moved from, they used to have like maybe 500-degree days. Now they have usually, I think it's moving up to 20 degrees days above 100 degrees, right? So this is not good. And how do we think about excess heat? How does it harm our health? Well, our body temperature is 98.6 degrees, so that's our normal temperature. But as you start getting overheated, your body, your core body starts warming up and up and up and up. And as that body temperature goes up, you have problems, a lot of different problems. You have problems with dehydration. You actually have problems with blood clotting. You have problems with respiration. You have problems with blood vessel inflammation, and heat stroke or nerve problems as well. So there's a lot of different things that can impact you when the heat goes up. And one of the things we can think about ourselves and how we keep ourselves cool. I'm retired now. I don't have to go outside anymore if I don't want to. Yay. But like in Colorado, there's a lot of kids that start school in August. And that's been the tradition there. Half the schools, elementary schools in Denver, Colorado, are not air conditioned. So these kids are going in and teaching in being learning in 90-degree rooms, which is not good. And actually, my nephew in Buffalo, who's an elementary school teacher, has a problem there as well. So our schools, our public places that weren't used to having air conditioning to provide cooling aren't there and available anymore. I wanted to talk a little bit about another temperature. I talked about heat index, but there's also called the wet bulb globe temperature, which is a tough one to think about. This is the temperature, the wet bulb temperature is what happens in the sunshine, but it takes into account not only heat and humidity, but the sun, the UV index, and the wind. So it's a much more comprehensive one, and it's what affects you in the sun. And this is really important, especially for people who are outdoor workers, people who are working outside. And I brought up here just one story, and I'll just try to remember it from memory, but it's a story from Morbidity and Mortality Weekly Report, which will no longer be published. It's from the CDC, and it comes out every week of different kinds of case series about different things. And it was an agricultural worker in North Carolina who was outside working in 90-degree weather, and They noticed he was confused, slowly got more confused. He was 56 years old, not that old. And by the time they got him to the hospital, his body core temperature was 108 degrees, right? And passed away from heat stroke. So you hear people going hiking when it's super hot out and don't think about bringing enough water. We have to pay attention to heat and its effect on our bodies, because if we don't, it can be fatal. The other picture I have here is from my daughter-in-law, Lindsay Kreischer, who works in the Center for Health Work and the Environment at Colorado, and they do studies of sugarcane workers in Guatemala. And if you think about things are getting hotter here, in Central America and Mesoamerica, where we get our sugar and our coffee from, the heat is going up quite a bit, and these workers are suffering from a number of different heat-related illnesses, but including chronic kidney disease. And so working on trying to think about that. But we all like our sugar, we like our coffee, but the people that are making it for us are being severely impacted by elevated heat. The other thing to think about is that we can have different susceptibilities. How many people here know that some medicine you take would affect your ability to respond to heat? Anybody know that? Jared does, but most people don't even think about it. Doxycycline, an antibiotic, can affect you. Antidepressants can affect you. Diuretics can affect you. Blood pressure medicines can affect you. So if you're on any kind of medicine like that, you want to talk to your doctor about that and be much more careful, because you're not able to regulate your body temperature as well, and you can succumb more quickly to heat stroke. People with kidney disease have a problem. You have issues with electrolyte balance. Cardiovascular disease, having the heart work harder to cool you off and get that body temperature down. Lung problems, breathing better, so not able to respire and get that cooling capacity. Diabetics actually have some issues with heat-related stress as well. So it's not just, when we think about sort of heat stress, and especially as I'm getting older, I'm much more aware of sort of the chronic conditions that might be impacting me and the people that I love. We all have to think about this, sort of the heat-related illnesses and how heat can impact our health. The other thing is to think about wildfires. Again, we've been hearing about this in California, and the horrible wildfires are there. My brother-in-law has COPD. He lives in Huntington Beach, maybe 30 miles away. Was actually feeling like he maybe was getting close to having to leave the LA area and go somewhere else, because he just was having a struggle breathing. Here in Vermont, we don't have the wildfire impact we thought we were going to have, but we have it from Canada. So the burning of the fires up in the Canadian in Quebec have all come and had air quality issues here in Vermont. So we're not, in the West we get it a lot, but it's here as well. So what do we worry about wildfires in our breathing? So has anybody heard about PM 2.5? Little bit, right?
Is it from diesel?
No, it's no. It can be. It's from the wildfire smoke, but it's PM 2.5 means particulate matter 2.5 micron. So just a shorthand for it. And if we look at this diagram, if you could actually see it, a grain of sand is about this big. A hair is about this big, and the hair is 50 to 7 microns. So think about your hair is 50 to 7 microns. Dust and the allergens you breathe in is about 10 microns in size. And then the particulate matter from burning from forest fires is PM 2.5. 2.5 microns are smaller, right? So very small. The problem with that PM 2.5 is that if you breathe in allergens, it gets stuck in all your nose and all the mucus and cilia that's here. But if you breathe in stuff that's 2.5, it can actually get deep into your lungs and actually move into your bloodstream and can cause problems that way. This is an issue for people with lung disease, asthma, myself, people that have older adults sometimes, children, pregnant women. So we have a lot of groups that are very sensitive to exposure to PM 2.5. So that's another thing to worry about. And then lastly, we're going to talk about infectious disease. Again, within the Northeast region, the insects are temperature sensitive. As I said, they're called ectotherms. I love that word because they can't regulate their body temperature relative to the environment. So if it's too cold, they don't do much. If it's too warm, they have to have that Goldilocks temperature. But warmer temperatures longer actually allows them to breed more and to move their range to places they typically weren't before. In contrast, like some areas in the Southwest, there's insects that aren't showing up there anymore because it's just too hot and dry for them too. So the converse can be true. But where we live here in Vermont, ticks are a big problem, and they're here actually an endemic all throughout the region. And they transmit Lyme disease, they transmit babesiosis and anaplasmosis. I had that done just for you, Reed. Do you have a question? Anybody? Okay. So these are, and the statistics in Vermont is the number of Lyme disease cases have gone from 100 and a little bit about over 100 back in 2005, 20 years ago, to over 1,000 now. And to realize that those are the reported cases, those aren't actually the incident cases of Lyme disease. There's a lot more around there. So what I'd recommend to anybody, if you ever get a tick bite, get your doxycycline, but don't be exposed to heat because that's one of the drugs that affects you with the heat. So that's my big picture overview of health impacts, just thinking about air quality, especially in focusing on the wildfires. Luckily in Vermont, we don't have the air quality issues like we do in Colorado, in the Denver region, with a lot of high level of ozone. But we do have that exposure, especially to the wildfire. So I think about, because this is a transition town and we think about resilience, our individual resilience, we can think about how do we deal with these issues. One is to, on our phone, and look at the air quality and the heat index that's on our phone all the time so we can pay attention to that and know whether we should go outdoors or not. I would recommend for anybody with any kind of underlying chronic conditions to get an air filter for their house for those occasions when wildfires come through and air quality is bad, and really work on preventing yourself from getting tick and mosquito bites, which sometimes here is easier said than done, but it's definitely things for us to pay attention to. On the mosquito side, though, don't spray random pesticide. That's bad for us for so many reasons beyond our health issues. At the community level, one of the things, what do we do as a community together, right? And how do we support our community? And we can think about making climate adaptive designs. We can start thinking about that. Building in flood resilience are things we can consider as well, right? We can think about how we work together as a community through our connections with each other. And you can see the value of the community again in LA in the face of those fires and destruction, how people are coming together to support those communities that have suffered both locally, then obviously more broadly. And I think the other one I have here is fostering and sort of creative imagining the future. The two books that that are in the other room are thinking about the future we choose, right? We talk about the health impacts. It's important for us to adapt to our changing climate, but we can also choose the world that we're going to be working in and living in. So the last piece I want to talk about, and maybe spend more time and think about this with the larger group here, is the impact of climate on food, right? So the thing about food is that climate can, we want to think about the food systems, right? So when we think about our food, we have to think about it from the farmer that produces it, how it then gets and transported to the market, how it gets made into other food products, how we eat it, either at the restaurant or at home. So there's a whole process along the way. And climate will impact, and what you can't see there, but everything's going to impact our food systems, right? You got a hurricane, it's going to be a problem. You got extreme rain, you got drought, you got fire. The El Nino, the changing temperatures, the shifting for our farmers of not knowing when the weather's going to be, you know, it's just this sort of more unpredictable weather patterns. So it impacts our food systems at all places. And so this adaptability we've got to think about, and working on thinking about our farmers, how do we help them with that adaptation? But there's a flip side to that. And not only, I'm sorry you can't see this, but I'll just spell it out for you. The food system also is one of the major contributors towards greenhouse gas emissions. Did anybody know that, our food system? 26%. 26% of greenhouse gas emissions. So 75%, 3/4 are burning of fossil fuels, but 1/4, which is stuff we can have impact on. We can also reduce our fossil fuel use, but that's a different, that's a talk for another day. But for what we can do here is thinking about how does food impact climate emissions. And we can think about it at the supply chain, moving transport, moving food from the agricultural sector, tractors and so on. We have livestock and fisheries. We've heard about cows, sorry to say it, but they burp methane, it's not good. A major contributor towards greenhouse gases, methane is one of them, CO2, methane are the two biggies. Crop productions is there, and land use. So all of those things can contribute towards our greenhouse gas emissions. And they also have a big environmental impact just beyond the food production. This is a slide that sort of goes through greenhouse gas emissions, land use. I didn't know this, but 96% of mammal biodiversity is animals for food production. 4% is wild animals of our mammal biodiversity on this planet. That's just a phenomenal number when you start thinking about that. Bird biodiversity, 71% is poultry, and the other 30% is wild birds. So really when you think about the amount of energy we put into that agricultural use, it's a huge contributor. Not that we don't want to eat, so I'm not saying negative about that, but it's just for us to be aware of the impact of our food systems on our environment. So I'm going to stand here. Which of our food products would have the highest impact on greenhouse gas emissions of the things we eat? Beans, chicken, fish, beef? Beef, right? It is beef, and it is 180 times more greenhouse gas a serving of beef than a plate of beans. That said, I do like my steak every now and then. So, back in the mid 2020s, 2017 or so, the Lancet commissioned a group. It's called the Eat Lancet Commission on Food, Planet, and Health. They brought together a number of scientists and nutritionists and policymakers from around the globe. They tried to study, well, how do we help with this planetary health? This is a big issue. What do we come up with? How do we think about a better diet, right? And they came out with this, what's called the planetary health diet. And I really want to share this with you because I get really excited about this in my own geeky food sort of way. But this comment here is food is the single strongest lever to optimize human health and environmental sustainability on Earth, right? If we think about that, that's a huge thing that we can actually contribute to in our daily lives to make a big difference to the world around us. And their diet for sustainability includes meat, and it includes cheese, because I couldn't give up my cheese either, so I was very happy to hear that. But it's a more plant-forward diet. So they talk about having your plate be, half the plate be vegetables and fruits and green things like that, and the other half to have beans and have cheese and have protein and other sources of protein. But it sort of splits it and kind of changes that so that the meat is maybe a part of your plate, but it's not the dominating part. And I grew up in the 60s, and my mom, we loved our Sunday roast, right? And you'd have roast beef and leftover roast beef, and that's how I like to cook, but we don't cook that way as much anymore. So learning how to cook different. And in their dietary recommendations, I'm just going to read this, they have every day a single serving of either yolk, milk, or cheese, so a dairy product every day, so they're not saying no dairy. And then a protein source, seafood, poultry, and eggs, and then you could have a meat, but try to do it just once a week, so reduce the amount of red meat you're eating from having it every day. And I think a lot of people have moved away from that, but not enough. But that's a sustainable diet, and the important thing about that diet is that compared to our current diet, it actually reduces our greenhouse emissions as much as going to become a vegetarian or vegan. Not that those aren't good things to do too, but I know for myself, I have a hard time. I've tried to go completely vegetarian, and I personally can't do it. So, and I'm glad people can, but I know a lot of us, especially a little bit more traditional about our eating habits. So this planetary health diet is a diet that a lot of us can switch over to And it is good for the planet, and it's also just as equally good for our health as well compared to vegetarian or vegan as well. So it's a way to start thinking about food that's going to be a little bit more positive. It doesn't ask us to make a huge change, but it'll have a huge impact. So if you think about it, you have 3 meals a day everybody eats. Well, some people might not eat 3, but we'll just say on average 3 meals a day. And you times that by 365 days, you get over 1,000 meals a year that you're making a dietary decision on. If you have a family of 4, that's 4,000 meals. That's a big difference in terms of thinking about what choices you can make that have a huge impact on the planet and your health. It's a win-win. So there's a lot of things then if we think about what we can do, trying to go meatless a little bit more often, reducing our, have our meat make a smaller portion of what we eat. The other thing is talking about being a trendsetter for a sustainable diet. You know, one of the things I talked about to begin with is that we need to talk about the climate crisis and how it's impacting us, and we don't talk about it enough. If you say, I'm going on a sustainable diet because this is why I think it's important, and learn more about that Eat Lancet diet, and it's healthy for us, it's not asking you to give up everything. Be a trendsetter and let people know why you're changing your diet habits, how important it is for your health. If you're just from a health perspective, it makes complete sense. And if it's healthy for you and healthy for the planet, it's a win-win. So really letting people know why you're choosing a different diet and switching over, so talking about it. And then I brought this in as well because, and it's not my expertise, but it's important for us, again, thinking about the food hub and transition town, thinking about regenerative farming practices and how important they are. We had the talk, which I missed the movie on, what's the name of the movie?
Common Ground.
Common Ground, thinking about regenerative farming practices and how important they are as well for improving our health. So, changing our diet. Food waste. Here's the other big problem we can also really work on as a community, as an individual. It's a huge problem. It's a huge problem. If the annual global food waste by sector is in huge tonnage, I think I'm going to just switch to this slide here. If food wastage were a country, it would be the 3rd largest greenhouse gas emitter in the world. The #1 greenhouse gas emitter is China, #2 is the US, #3 is food waste. Think about that. The 3rd largest is food waste. Wow. And that's a number we can all work on within our own lives. So why do we have in the US, 30 to 40% of food that's generated is actually wasted, 30 to 40%, which is a huge number. And 43% of that actually then comes from individual households. So again, this is a big difference we can make. Valued at $165 billion annually of money just down the drain or in the trash. And importantly, when we think about food waste, I wanted to talk about this because when we put so we have our white plastic trash bags, super nice and convenient. Now we got more plastic everywhere. You throw your food waste in there. As a kid, we just scraped everything off in the trash and never thought about it. That goes in a bag, it goes in a landfill. When you think about that landfill, things get dumped and dumped and dumped. That becomes anaerobic. There's no air in the bottom of a landfill, right? And when the food breaks down anaerobically, it releases methane gas. Methane gas is the #2 greenhouse gas that's a problem. It's shorter lived than CO2, so it's not what we measure in those ice cores that go back 800,000 years, but it's actually more serious, more heat trapping than CO2 is. So shorter lived, but more CO2 trapping. We don't want methane, but that's what gets produced when you have anaerobic degradation of plants. Yeah, Jack?
You forgot, it goes in a garbage truck too.
And it goes in the garbage truck. And why is that a problem? Because the garbage truck uses gas. Yeah. That's right. Exactly. So we have a big issue there too, right? So we want to think about other ways, alternatives, not to have food waste to begin with. Try to think about our habits of buying food, wasting food, and composting. And you say, okay, well, composting is piled on, you get heat, but you have aerobic degradation because the air, it's not that compressed as you think it is. Oxygen definitely gets in that compost bins that we have. So, did you know that Vermont is only one of 8 states that has a food waste law. I didn't know that. And we moved here this summer. Nobody told us about, there's no education on food waste for newcomers to Vermont. We had no idea. We're just not really paying attention until luckily we have family here that reminded us. So, but it's 8 states is not enough, right? We all have to have food waste laws and how to help people do that. But I would say what's the problem is it's not really easy to figure out what to do with your food waste, right? It's not, Jared and family have a worm composter, which I find, don't like worms. We have a little loamy composter that works in our house, but we live right near where the bears come down, so we can't really put food scraps out in our trash. So there's places here in Vermont that you can take your trash to, but if you're having challenges with disabilities, or you're a senior and you can't get out, how are you going to get your food to the compost, right? How are we going to help people? And I think this is one area we could actually think about with food waste, is how to make it more efficient within our community so that people that don't know what to do, don't know how to do it, can help start working on that together. Because when you think about that, China, US, food waste, number 3 emitter, and that's something we can all do very easily for ourselves and for our community. So, the other thing for food waste, best by dates. Who knew there's no structure or regulation? Did anybody know that? There's no, you did, okay.
I just learned that in the last 6 months.
Yeah, so there's no statewide there's no mandate on the federal government. Every state has its own best by, expiration, shelf life. And when you look at a package, you don't know exactly, does that mean I have to throw it out because it's the shelf life, it's the best by? So this thing about, there's a food I've thrown out because I'm afraid it's going to cause poison to me. And I study infectious diseases, but I'm very cautious about things that, food toxins, right? So we have to work on trying to understand our labeling of our food so that it is appropriately labeled and maybe nationally labeled so that we can understand that food and not throw it out needlessly, right? Shelf life is different than best by versus sell by versus expiration. And I had no idea actually until I was putting this talk together, and I thought, oh, wow. So we can start exploring that together. So I think, to think about preventing food waste, there's a lot we can do. We can think about just on the basics for our own self-managing portions, meal planning, making sure you don't buy too much, not buying in bulk unless needed, Costco shoppers. Didn't say that out loud. Education of best by dates. Simplify discarding food waste so we can think about how we can help other people discard their food waste if they don't know how to get rid of it. Make it easier for people to get rid of their food waste. And also thinking about consumer power. One of the other sources of food waste is not just us, it's our grocery stores, right? That get rid of things that aren't quite good enough. Or overstock their shelves to make the look of abundance, and so we walk in there's abundance, but then they expire, although we're not sure if that's the right date, and they get tossed aside. So those are other things we can do. So I'm going to just wrap up here, and thanks for sticking with me. I love this quote, and it's from people have talked about Malcolm Gladwell with the tipping points, but there's a lot of people who are studying tipping points, and there's the negative tipping points where things can go in the bad direction, but we can also talk about understanding positive tipping points. And this was a paper, which I forgot to put the reference on, about a positive tipping point. And it says, small actions can lead to significant changes that ripple through social systems. This means that both policymakers, something we're having a hard time control, and everyday people have a lot of power to influence big changes. And I think it's something for us to remember that all of us can make those bigger changes and make those social connectivity. That's why I'm really happy you all came here tonight, thinking about the changes we can all make as an individual and as a community to affect changes in the climate. And then that also improves our health of ourselves, our family, and our community together. So I want to leave, lastly, this is, you can't really see it there, but it's a planet Earth, and it says all of the problems pointing down at planet Earth. But at the bottom side is all the solutions, right? We have the solutions to deal with the problems we're having, and we have to work together to do that. And I like this quote. This is Krista Tippett, who does a podcast on being. And she said, hope is a verb with its sleeves rolled up. We hope for a better world, but we hope because we roll our sleeves up and get busy making what we believe in something that we can move towards. So Thank you very much.
You talked about food waste. China, United States, and then food waste. Is that food waste number globally?
Globally, yeah.
Globally.
Yeah. Some places like in Africa, food waste occurs more at the production side. So say you get wheat that's harvested but then gets fungus in it. It's less at the consumption side but more at the distribution side where environmental conditions can have a huge impact on food storage and degradation.
You had a chart on CO2 going back, and this chart was zigzag.
Yeah.
So that was really right. Why was it? What happens? It kind of
that's
goes up
really cool.
and then drops and goes up and goes drops. So what was going on over
The
those
Earth actually tips on its axis as it goes around the sun. And we have a natural warming and cooling cycle that occurs that also affects that CO2 in that cycle. I think that's what they think is causing that sort of cycling. It tracks with the warming and cooling of the planet. So our planet naturally warms and cools and has more respiration and less respiration, but that's what they think that's from.
But what's the periodicity? Is that like a year?
Oh, no, 10,000 years or so.
Really?
Yeah.
I think that Mauna Loa does in fact have an annual cycle, which is the trees.
Right.
So that in the northern hemisphere, which is most of the terrestrial, all of the trees all of a sudden start picking up CO2 and putting out oxygen, and so the CO2 comes down, and then winter comes and it goes back up.
Right.
So
there's annual periodicity,
Annual,
and then
yeah.
there's also that glacial
The much
longer periodicity, but that is from a 10,000 or so year period of time. So it's a fairly consistent since things have been growing on the planet. Yeah.
I'd like to say, one, I really enjoyed this, and I think it's a really great thing. And one thing I would like to say, it's kind of my own personal hobby horse, and that you were really beginning to get there and touching on it. But so often we treat our climate and so on as this big, all these sacrifices we've got to make, and everything we've got to do without, and what we can't have, and so on and so forth. But even thinking about your food things, I mean, the vegetarian diet, I mean, it's very adventurous. Indian cuisine, for example,
Right.
is almost entirely vegetarian. Many, Oriental dishes. Mediterranean cuisine has a very high component of that. And so it's actually interesting and fun and really tasty to eat that way. It's not just a matter of, I can't have my hamburger or my roast beef. It's, wow, I could have aloo mater tonight, or, we can have, something like that, and make it a very positive sort of thing. And I think that can make a big difference in how we approach it. It's not a matter of, oh my God, I'm giving up everything I want, and so on and so forth, but this is a great adventure and interesting thing to do. And the food is really good. I mean, we're mostly vegetarian at this point. And I think that's another thing that, again, you really hit on it nicely, is that all of this is a matter of degrees.
Right.
If you can, if you can't be a vegan, you can be a vegetarian. If you can't be a vegetarian, you can be a sometimes-itarian. And and if you can't do it, like 6 days a week without, then you do 1 day a week. I mean, it's everything that you do helps.
Right.
And so nobody should ever tell you, oh no, you're not doing the right thing or something. It's like anything that anyone does contributes, and I think that's also important.
Good, really, really, really great points. And actually, this is talking with Emma about thinking about different dishes. So we were talking about how do we come up with. I learned how to cook one way, and I've been training myself and trying new dishes in my rotation because I like to cook and eat different food. But to your point, it's like when we go over to her house, she makes a new dish, and it was a black bean soup, and it was absolutely delicious, right? So how do we share dishes that are tasty and really get people thinking about cooking together and trying to be more adventurous with our food styles? And it's just a matter of learning more about it, right? And how do we understand it? Life is not all pizza, right? So there's a lot of, although I like pizza too, but there's a lot out there that we can do, and especially this issue of degree, right? We can't be black and white. You either have to be all one way or all another way. We're all making our efforts to help the world that we know and live in. Yeah, and we make the efforts that we can make. Yeah.
I was curious, you said you study infectious diseases. I was wondering if you could talk about that a little bit, maybe a bit about your research and also in relation to climate change.
Yeah, that was at the, I study, that's okay, no, that's good. I study malaria. And so I work in Kenya. I have a research program based there. Study how the body fights off malaria, so the study immune responses and immunity. And I have a lovely group of students that I've trained there over the years. We have a clinic there. I always think about Kisumu, Kenya is like my second home. I love going there. Usually January is a nice time to go too. But because I study malaria, it's transmitted by a mosquito. And the mosquito is a climate sensitive, it's a climate sensitive disease then. So malaria is moving depending on how the mosquito is doing. And so that's what got me thinking about climate change. Not so much my own research, because it's more immunology. It's studying malaria, which the disease itself is climate sensitive. You're welcome.
Could I follow up on that stream? You probably read research that has been devoted to eradicating mosquitoes using genetically engineered releases.
Yeah.
And I'm just wondering if you or your colleagues have given thought to the role that the mosquito populations play in wild bird survival, and what the effect of eradicating part of the ecosystem just because it might benefit people, what effect that would have on the rest of the system.
Well, I would say I am strongly against any idea of eradicating mosquitoes. So as much as I don't like the little buggers, they do serve an ecological purpose, and I am very vocal when I'm in crowds to talk about that and say this is a bad idea. For so many reasons, but mostly they're a source of food for bats and all kinds of things. So I think that that's the wrong approach. The people that I work with and the work I think about is development of drugs to treat malaria and vaccines to prevent malaria. And those are really the tools. Vaccines are really important tools for us to prevent infectious diseases. So that's the take I take from, and I think you're absolutely right, and I think if we hear people talking about that, we should be very vocal in discouraging them.
Is it a little different what they're doing with the birds in Hawaii? They making the mosquitoes like, so they can't live, but they still live for like bats and stuff?
Yeah.
Like avian malaria is going up the mountains and
Right.
killing off the last of the Hawaiian
Birds.
native.
Yeah. So it's a balance there, but that's not quite. This is what they're talking
Yeah.
about is like a gene X that just eliminates all mosquitoes. Okay. They're putting in, what you can do is shift a population. So if mosquitoes are where they're not supposed to be, you can actually put in male mosquitoes that can't breed, that breed with the female mosquitoes, and that can eliminate them from an environment, but that's not a long-term change. Yeah.
Thanks.
All right. Well, again, thank you all very much.
Yeah.